In the second part of the video, we will discuss about GIT drugs, that it is specifically of peptic ulcer drug. And yesterday we have studied about H2 blocker, antihistaminic drug, and today we are going to study about proton pump inhibitor. Proton pump inhibitor drugs include omeprazole, esomeprazole, lansoprazole, pantoprazole, and S-pantoprazole, rabeprazole, and dexrabeprazole. These are the drugs which include in proton pump inhibitor. Now we will see what's the mode of action of this drug, how this drug work. So for this you have to learn some words like gastric hydrogen potassium ATPase and parietal cell and inhibition of secretion. So normally stomach have cells, that is parietal cells, and the basolateral surface of the cells have specific enzyme, that is hydrogen potassium ATPase, that is present on the cell membrane. So this is the luminal surface of the parietal cells where we have the hydrogen potassium ATPase, a cell membrane enzyme, which have major function to secrete hydrogen ions and increase the acidity of the stomach. So all these drugs basically inhibit the production of hydrogen ions from this enzyme and decrease the acidity level of the stomach. It's mostly present in capsule form, tablet form, and also IV form, and we can take it to 20 to 40 milligram. So the another category is anticholinergic drugs. As you know, during rest and digestive state, our parasympathetic nervous system through vagus nervous system activate the enteric nervous system of the GIT, and it have function on stimulating GIT motility and increasing the gastric secretion by releasing acetylcholine. So the anticholinergic drug is basically cholinergic antagonist, that it inhibits the cholinergic receptor, and specifically we have M1 type muscarinic receptor on the GIT. So when this M1 muscarinic, or we can say cholinergic receptor, is blocked, inhibited competitively by anticholinergic drugs, so the available cholinergic will not work, and hence the production and motility of the GIT will be reduced. So we have a specific drug, pyrinzapine, which is anticholinergic drugs and mostly used in peptic ulcer. So these drugs selectively inhibit the M1 type muscarinic receptor, and we can use in a dosage of 30 to 50 milligram. Another drug is prostaglandin analogue. Prostaglandin analogue is similar to our body prostaglandin, and this drug have a very effective role in healing the ulceration in stomach. So the first function of this drug is it basically inhibits the histamine stimulated increased cyclic AMP of the parietal cells. It means that every cells have their cyclic AMP. So when parietal cells have increased level of cyclic AMP, so it will increase the production of gastric acid. So this is basically inhibited by prostaglandin. So another function of prostaglandin is it stimulates the secretion of bicarbonate, that also neutralizes the acidity level of the stomach, and it also increases the gastric blood volume, also help in releasing the growth factor of blood vessels that help in angiogenesis, and it will be helpful for healing the ulceration of the stomach. The prostaglandin analog drug includes arbaprostil, inprostil, misoprostil, rioprostil, rimoprostil, and all these drugs can be given in a dosage of 100 to 200 milligram. So now we have completed the drugs of gastric acid secretion inhibitors. In the next video we will focus on antacids, that is gastric acid neutralizers.